Hello, welcome to this webinar. My name is Alexandra Kahn-Johnston, and I'm ISEP's Director of Health, Safety, and Risk Management. Today we'll be discussing how to prepare for a safe experience abroad, ISEP's health and safety policies and associated student responsibilities, health and safety abroad, and what to do in the event of an emergency. In terms of preparing for a safe experience abroad, you should carefully review all of the information found in your ISEP dashboard, including your acceptance package, your pre-departure information, and the health and safety information tab. You should also review the health and safety information in your ISEP country handbook and the recording of your country-specific pre-departure orientation. All students are required to enroll in ISEP's health and safety program, which provides global assistance services along with health and evacuation and repatriation insurance. We'll discuss insurance later in this presentation. Prior to traveling, you should make copies of all of your original documents, and we recommend that you both print a hard copy to carry with you when you travel and either email yourself the electronic copies or upload them to an online drive like Google Drive. This will make sure that you have access to them if needed while you're abroad. Finally, before you depart for your program, you should enroll in your country's alert system for travelers abroad if this is available. So an example would be the STEP program for US citizens, but you should check with your consulates abroad to see if this is offered for your home country. In terms of preparing to stay healthy when abroad, you should start by scheduling any routine appointments before departure, along with visiting a travel medicine clinic if specific vaccinations or anti-malarial medication are required for your destination. And you can check your country handbook in the health and safety section to see if this is recommended. And this section also links to this US CDC website, which has traveler information. Once you're enrolled in the ISEP Health and Safety Program, students with pre-existing conditions can open up what's called a continuation of care case with AXA, which is the global assistance provider under that insurance. You will be connected with one of their staff members, and they can help ensure that you're able to follow your established treatment plan abroad, including providing information about your specific medications and setting up initial specialist appointments abroad. Generally, whenever possible, students should order your prescriptions for your entire period abroad. If this is not possible, you can utilize that AXA continuation of care benefit with help researching the availability of your medication, but it's really important to know that not all medications that you receive in your home country will be available in the exact same formulation abroad, and it can take time to be re-prescribed that medication by local providers. When you arrive in your host country, you should register your presence with your home country's embassy abroad if this wasn't already accomplished by signing up for embassy alerts that I talked about a few slides ago. You should also add the following emergency contacts to your phone and keep a paper copy in your wallet. And fill out your local emergency contact information in your ISEP dashboard. ISEP will send you reminder emails after your arrival about filling out that local contact information. And we use this in case we need to get in touch with students in the event of an emergency. And this is what that form looks like. Please make sure that the phone number and means of communication work abroad. So don't list a number you won't be using while abroad, or be sure to indicate that, for example, your home number is only available on WhatsApp. In terms of ISEP protocols and policies, please review the ISEP Health and Safety Policy and the ISEP Student Code of Conduct, both of which you acknowledged when signing your ISEP contract. And remember that your decisions can have an impact on your health and safety while abroad, so it's important that you're using common sense, taking responsibilities for your actions, and when in doubt, playing it safe, especially at the beginning of your programs when you're not as familiar with your new location. Please also be sure to review in detail the Student Code of Conduct, as you are ultimately responsible for following these rules and regulations while you're abroad. In terms of health and safety abroad, I first want to review the insurance coverage provided by ISEP's Health and Safety Program. This is a lot of information, and you can go to the insurance section or in the health and safety plan section of the ISEP website to learn more. That's where you can find the detailed policy brochures and more information about the CISI health insurance and AXA assistance, global assistance insurance that's provided under the health and safety plan. So CISI is the health insurance provider, and that's Also to whom you will file any claims for care that you receive abroad. AXA Assistance provides travel assistance, evacuation, and repatriation insurance under the umbrella plan. So the ISEP Health and Safety Plan covers students outside of their home country within the dates of enrollment listed on the insurance ID card that you can find in your ISEP dashboard and in the email you receive from CISI upon enrolling in the insurance. And normally, if you have a non-medical problem, you'll first visit University Health Center or a local clinic. Typically for medical emergencies after hours, it's recommended that you visit the emergency department at a local hospital, but this is more expensive and generally will not lead to any quicker care if you're going and it's not a medical emergency. More information about local healthcare resources can be found in the health and safety section of your ISEP dashboard and will also be covered by your host institution during your on-site orientation. It's important to note that if you are anywhere outside of the United States, typically you'll be required to pay upfront out of pocket for any non-emergency medical expenses, and then you'll submit a claim via email to CISI for reimbursement of those costs. So a copy of that claim form is included in the email you receive from CISI at the time of your insurance enrollment and can also be accessed via the CISI participant portal that you received login information about in that very same email. More information about healthcare inside the United States, which is a bit different, is covered as part of the U.S. country-specific pre-departure orientation because it's specific to those who are studying inside the United States. So please be sure to review in detail that section of your country-specific pre-departure orientation before arrival. While, again, outside of the US, it will be most common that you'll be asked to pay upfront for medical expenses and then submit a claim for reimbursement. If you ever need assistance with payment arrangements for larger expenses, for hospitalization, for more expensive tests, you should contact AXA using the number on your ID card to confirm coverage and arrange payment directly between the insurance company and the hospital as soon as possible. You can also contact your ISEP Student Services Officer if you have any questions about how to arrange these direct payments. And again, more information about insurance can be found both in that welcome email from CISI, your participant portal with CISI, and in the insurance section of the ISEP website. In terms of personal safety abroad, much of this comes down to using some common sense to stay safe, and again, playing it safer when you're arriving and you're not as familiar and comfortable with your host location. So that includes in advance paying attention to security warnings and any that might come up while you're abroad, trying to follow local social norms and blend in a bit, certainly practicing safe and responsible use of alcohol if you choose to drink while in your program, and in part that's so that you can remain aware of your surroundings. Traveling in pairs or small groups rather than alone, and learning from your host coordinator the best and safest ways to travel at night, and if there's any neighborhoods or parts of your host city or your host country that you should consider avoiding for your safety. We really have as expectation that students are not attending protests, rallies, or strikes because while many times these are nonviolent, it can turn very quickly and become quite unsafe. It also may violate the terms of your visa to become involved in any protest or strikes in your host country as a foreign national. Mind your pockets, especially if you're in a big city, using travel wallets and safes in a hotel or in your dorm room. If you sense a potentially dangerous situation, remove yourself. And ultimately, it's all about looking to your host coordinators, local students, locals in general for information about safety around your host university and while traveling in and around your host location. A lot of this will come from your on-site orientation, but you can always drop by the international office, ask a student buddy if you have one for additional advice. In terms of common hazards abroad, we really recommend that you do some general research, whether this is on the consulate website for your host country, whether that's just by doing some light Googling or searching online, reading articles. to know a little bit about the common hazards for your destination and related safety tips. There's no one place in the world that's completely free of hazards. It's just that those hazards might be different based on your host location. And they can generally be split into the categories of natural disasters, physical hazards, environmental hazards, and social hazards. And it's especially important that you're doing this research if you know that the hazards are different from what you're used to encountering at home. So if you're from a location that does not experience earthquakes and you're going to be studying in Japan, which is a very earthquake-prone location, it's particularly important in that case, for example, that you read up a little bit about what to do in the event of an earthquake. This will obviously be covered during your on-site orientation and in your residence, but it's important to do your own research in advance. To minimize the risk of social hazards abroad, including sexual harassment and assault and theft, really, again, educate yourself about local cultural norms and establish your own comfort levels. Practice good situational awareness, as I mentioned on the previous slide. That includes traveling in groups or using a buddy system, practicing bystander intervention, and generally being aware of local laws, resources, and sources of support. Whether or not you have a pre-existing mental health condition, it's also important to acknowledge that you may struggle with mental wellness while you're abroad. There are a series of contributing factors that can lead to increased loneliness, homesickness, anxiety, depression, and other mental health conditions. And so anticipating your needs and making plans for supporting those needs is one of the best prevention steps that you can take while you're preparing to study abroad. For example, if you're currently receiving therapy, it can help to both make a plan for continued care abroad, but also help develop a mental health travel plan with your current provider. You can also be aware and utilize your resources abroad, whether that's your ISEP Student Services Officer, your host coordinator, information about resources at your host university and in your host country and city. And ultimately, Access Assistance can both provide referrals to therapists and other mental health providers in your host destination if you're having trouble finding that information in your ISEP dashboard or from your host institution. They also offer what's called remote behavioral health assistance for acute mental health situations. You just call the number on your ID card and they will provide up to 3 sessions free of charge, completely confidentially, that information, and then can provide information again about referrals to local healthcare providers. And certainly if you're concerned about yourself or a friend, reach out immediately to your ISEP Student Services Officer and or your host coordinator for support and assistance connecting to local resources, and immediately reach out if you are concerned about a risk of self-harm or about someone harming others. In terms of emergencies abroad, what we expect of you is, again, that you're aware of local hazards generally, that you're taking responsibility for your personal safety, and that in an emergency, you're following the official instructions of local authorities of your host institution. ISEP will also reach out if we're aware of a local hazard that might be new or upcoming. For example, if we become aware that there's a hurricane or an earthquake, we will reach out and relay information about that hazard, or for that matter, a demonstration alert for your host city. We ask that sometimes these are informative, and sometimes we're asking students to reply to confirm that you are safe in a particular location. If you ever receive a check-in request, you should reply immediately to that email. We'll also give you options to check in using the MyCISI app safety check-in feature or over WhatsApp directly with ISEP. So again, in an emergency, you're going to first follow local media, law enforcement instructions in a large-scale event, any messaging you're receiving from your host institution, whether that's by email or if they have text alerts set up. If necessary, you should first seek immediate medical attention from local emergency services. And then your first points of contact beyond those emergency services are going to be your host coordinator, who's located in your host city and is most able to respond immediately. You can call the ISEP emergency line, which operates 24/7, 365. There's always an ISEP staff member on call. You can help respond and coordinate resources and response. And you can use the check-in feature in your MyCISI portal, particularly in the event of large-scale events, to confirm your safety or indicate to ACSA assistance that you need additional help. And again, what that MyCISI safety check-in feature is, this is an app that you should all be downloading to your phone in advance of your program. It not only has this check-in information, it also has information about any local alerts that might be coming up for your location, in addition to any messaging ISEP might send, and information about local healthcare resources. While your host institution probably has the most accurate and recommended information for years and years of welcoming exchange students, this can be particularly useful if you're traveling to a city you're not as familiar with and looking for some information about healthcare resources that you might need during those travels. And then finally, in terms of some additional information, these are some of the pieces that we've linked to earlier in the presentation, but there's a wealth of information on the ISEP website, in your country handbooks, your MyCISI portal for more information about student health insurance information, resources about diversity, inclusion, and accessibility abroad, and certainly all of the information in your ISEP dashboard. External to ISEP, travel advisories from your home country's government and the website for your home country's embassy abroad in your host country can have useful information, not just how to contact them in the event of an emergency, but information for travelers in that location specific to the needs of travelers from your home country. The U.S. Center for Disease Control and Prevention, while a U.S.-based resource, really has great traveler advice for health concerns across the globe, regardless of your nationality. The U.S. Embassy also operates pages on each of their websites if you're finding that your home country's websites are a little bit scarce. And then the World Health Organization, again, in terms of health information. The other place that you might consider taking a look at, both in terms of what are the local hazards that they're telling tourists about, but also just general information about your host country, would be the official tourism site for your host destination. And with that, thank you for attending today. Again, you should contact your student services officer with any questions, concerns about any of the information found here, either before your program, or certainly they remain a great resource during your program for both general information and assistance in the event of an emergency, whether a personal emergency or large-scale emergency. And a final reminder that that ISEP emergency line number should really be programmed into your phone. It is available 24/7, 365. It does need to be called. It's not a texting number, but there's always a staff member on call to respond. So with that, we wish you a health and safety, safe, exciting time abroad, and thank you for attending today.